Hello, and welcome to this episode of And So It Flows. I'm your host, Nicole Krawcke, Chief Editor of Plumbing and Mechanical and PM Engineer magazines. Today's topic of discussion is Legionella prevention and mitigation, and I'm very excited to welcome our guest, Dr. Janet Stout, Executive Vice President and founder of Special Pathogens Laboratory. Janet, thanks so much for taking the time to be with us today.
Oh, Nicole, it's my pleasure.
So before we get into our discussion, why don't you share with our listeners a little bit about your background and, about Legionella, how you got involved in it?
Well, my career has been very fateful. And what I mean by that, it's sort of every turn kind of led me down the path of Legionella and Legionella prevention. So when I was looking to go to graduate school early on, I was calling about my application at the University of Pittsburgh. And by mistake, my call was transferred to the Graduate School of Public Health, Infectious Disease Microbiology, which is fate, right? And it was there that I was introduced to Legionella as a master's student. And then I continued to do work and got my PhD there as well. And so Legionella and I have been together ever since.
So jumping into our questions, Janet, there's been such an increased awareness regarding Legionella in both the plumbing and mechanical design and engineering community, but also amongst the general public over the last few years. Yet it seems to me like I'm always seeing news headlines, just more and more about, cases and how they're still rising. Why, in your opinion, why do you think that is?
Well, I'm a glass half full person, Nicole, and so I'm thrilled that there's greater awareness. I'm disappointed that we aren't further along. Certainly, that young infectious disease microbiologist that published her first paper in 1982 thought, for example, all hospitals would be testing for Legionella and preventing hospital-acquired Legionnaire's disease here in 2023. And sadly, that's not the case. But we've made great strides, and you do hear about Legionnaire's disease in the news. It's what I call a marquee microbe. It gets a lot of attention because of large outbreaks that have occurred historically. Like the most recent one was in the Bronx. There's currently a huge outbreak going on in Poland. It's an international disease, not just in the U.S. So there's room to continue our what we call our BHAG, our big, hairy, audacious goal. It's to end Legionnaire's disease, and I welcome everyone to join me in that mission.
Okay. So what do you think are the key factors that contribute to Legionella growth and proliferation within water systems?
Well, we've been trying to crack that nut for a long time. And if I had the answer for you, I'd be out of a job. But there are things that we know help promote Legionella growth and the growth of other waterborne pathogens in our warm water distribution system. So in our building water systems, it's primarily on the warm water side, because there's three things that Legionella and other bacteria need: nice warm temperature for growth, the presence of a lot of organic material. In plumbing systems, we see that as scale, sediment in our pipes. And then other bacteria and other microbes actually help Legionella to grow. And so that's, from a microbiology perspective, the sort of the ingredients for Legionella to grow within our systems. And then it's the presence of people that are susceptible to Legionnaire's disease is sort of the final piece. So you and I are healthy, and we could be exposed to a lot of Legionella in water systems, whether it's potable water or a decorative water feature or those misters at the grocery store, and really have no problem. But if you are elderly or on chronic medications for chronic lung disease like COPD, steroid medications, or the most susceptible would be someone who had an organ transplant and they are being treated with medications to suppress their immune system. So if that individual is exposed to Legionella, then they have a chance to go on to develop Legionnaire's disease. But even so, it's a pretty small percentage that do become sick. And so that's the good news. But the reason prevention is so important is because the chance of death is so high with Legionnaire's disease, particularly if it's acquired in a hospital. Nicole, it's 25 to 30% chance of death if you acquire this infection, this form of pneumonia, while at a hospital for some other condition. So,
Wow.
so prevention is the key.
Absolutely. Yeah, I definitely don't want anything to do with Legionnaire's disease. And I remember you speaking at the Emerging Water Technology Symposium last year, and it changed the way I travel. Like now I go into hotel rooms, I run the hot water like constantly, like for a while before I go anywhere near the water fixtures.
Well, that's a pearl, right? So all of your listeners, Legionella is only in about half of our large buildings. So you don't know, is this the building that has Legionella or this the building that doesn't? So flushing that hot water, purging the shower and the faucet with, maximum hot water for at least 5 to 10 minutes gets rid of the bulk of Legionella if it's sort of hanging out at the end of those fixtures. And so you're really smart, Nicole, to do that.
Well, I learned from you. So, are there currently any legal or regulatory requirements for Legionella prevention in different settings? Like you mentioned, healthcare facilities, hotels, or industrial facilities?
So on the legal side, in the state of New York, I mentioned the Bronx outbreak back in 2015. One of the glass half full results of that tragedy was that New York State and New York City developed public health regulation or law requiring in the city of New York all cooling towers to be tested for Legionella, clean, maintained on a certain schedule. And so that really went very far for prevention of cooling tower associated Legionnaire's disease in New York City. And then in the state, they did both cooling towers and healthcare systems. So hospitals had to test for Legionella, which traditionally most hospitals had resisted, and the Center for Disease Control and Prevention had no recommendation on that. So that was the first regulation or public health law. And I'm actually advocating for other states to implement other laws like that. And in the state of Pennsylvania, there's a pending bill. And actually, in about 8 other states, legislation has been introduced, although it's having trouble getting passed. Now, on the regulation side, there's been a lot of activity. As you probably are aware of, ASHRAE in 2015 published their standard 188. It's a voluntary standard, and work is being done to get that into building and plumbing code. And I support that entirely and enthusiastically, because as you know, some of these standards are voluntary, and people say, well, I think I'll pass. I won't do that. More recently, for hospitals, in 2017, the Center for Medicare and Medicaid Services came out with a memo, which is basically their requirement for hospitals to do Legionella risk assessment and water management. I was disappointed because they still leave it to the discretion of the facility whether to test. There's no way to do water management without testing for Legionella. So just let's make that very, very clear. And then more recently, in January of 2022, the Joint Commission for Accrediting Hospitals put out their new environment of care standard, which requires risk management and water management to be done in all of the hospitals that are accredited by Joint Commission. So that's like law. If you're a healthcare institution and you want to still receive Medicare and Medicaid dollars, you really have to comply with the CMS memorandum. So there's more work to be done. I know ASHRAE is really hoping that 188 is incorporated into plumbing and building codes. There's a new standard from ASHRAE, standard 514, that expands water management into chemical, physical, and other microbial hazards other than Legionella. So that just came out last month.
Okay. Now you talked a little bit about water management. Can you take us through, what a what a water management program entails and why it's essential for Legionella prevention?
So it's an approach, sort of looking at all the water systems that are associated with buildings. So it can be cooling towers, evaporative coolers, decorative water features, misters, so devices. And then there's the water system in the building itself. And a water management program starts out with a risk assessment. So it's, do you have these types of water systems? And then who's in the building? For example, is it a senior high rise, people that are at greater risk of getting Legionnaire's disease should Legionella be present? Is it a healthcare facility? Is it a large building? So in ASHRAE Standard 188, it's 10 floors plus grade. And that means that there could be greater risk. It doesn't mean that smaller buildings, there's no risk, but we had to come up with some criteria. And so the idea was larger buildings and buildings housing people at risk. If the answers to these questions are yes in the risk assessment survey, that means that a water management program and plan are necessary. And so the starting of a plan is really assembling a team. It's the program team, creating what are called process flow diagrams, mapping out where water comes in, where it goes. It doesn't have to be much more than a block diagram, but the idea is, are there places within these water systems where Legionella can grow and spread? Is there a cooling tower? Is there warm water systems? Is there softeners, misters, that kind of thing? And if the answer is yes, then this program says, okay, let's focus on that and develop some controls that would prevent Legionella from growing and spreading. So in the easy example of a cooling tower, it's biocide application, and then regular monitoring of that biocide. Let's say it's chlorine or bromine. In a plumbing system, some of the controls might be temperature. One of the things that's tricky about temperature for healthcare facilities, it's kind of like having one hand tied behind your back. You can't turn the temperature up very high because there's scald risk. Mm-hmm. So you really can't control Legionella risk with temperature, but you can create sort of an environment that's less conducive for Legionella, and making sure that the hot water system is balanced. And this is part of the standard in Section 8 in design and construction. So this is sort of the elements of the program. And then you have to, it's called validation and verification. You need to make sure that the plan is executed as designed. And then you have to validate that the hazard's under control, which in the case of Legionella, it's Legionella. Well, how can you validate that Legionella is controlled without testing for Legionella? You can't. So you really have to test for Legionella.
Yeah, that makes sense. So what are the critical components of a comprehensive Legionella risk assessment in a facility's water system?
Well, I think now you're asking, so one of the things I say is when an infectious disease microbiologist like myself has been doing Legionella for more than 30 years, I'm not a microbiologist anymore. I'm a Legionellologist. Yes, I did make that up. But this Legionellologist would say that the most critical component of doing water management is determining, is this building, is this plumbing system in the 50% that has Legionella or the 50% that doesn't? And the reason that's so important is people keep saying Legionella is everywhere, it's ubiquitous. Well, it's not. And I'm not saying that, Dr. Stout's saying that. That is study after study after study, including our own, where we look at whether or not Legionella is in these large buildings. And for hospitals, we showed it somewhere around half. Rule of thumb is half. And we even did a study of high-rise buildings in New York City, and the same thing was true there. About half had Legionella. So wouldn't you want to know, is your building one of the half that has Legionella or not? If the answer is Legionella is not here after you test for it, well, you're good, I'd say, for 6 months. You want to retest again to make sure nothing's ever changed. If you're in the group that has Legionella, that first test is the most important one, because now there's risk, and then you mitigate the risk. And there's a variety of ways to mitigate Legionella risk in plumbing systems.
So that's a great lead in for our next question. And you mentioned, you can't really control it with, increasing the temperature. So what are the recommended strategies for controlling Legionella growth?
Well, the first thing that we look at is what is the risk profile of the building. So let's say it's a university building and it's a bunch of 20-year-olds that are robust and healthy. Well, Legionella can be there and cause no trouble whatsoever to that healthy population. But if it's a senior facility, for example, a retirement community, and we have tested and found Legionella there, well, we want to do something about it. Now, Most often, you will have to add supplemental disinfection. And what that means is the amount of disinfectant coming into the building from the municipality, whether it's chlorine or monochloramine, isn't enough to control Legionella. And for example, chlorine, when it gets into the hot water system, basically disappears. So you add additional disinfectant, and typically monochloramine can be added to both the cold and the hot. Copper silver ionization is traditionally on the hot because a flow cell is put into the recirculating hot water to build up the copper and silver ions. Chlorine dioxide is typically applied to the cold water side because it's like chlorine, it disappears in the hot water. So chlorine, monochloramine, copper silver ionization are the most commonly applied disinfectants, as well as chlorine dioxide. So there's a number of tools in the toolbox to be applied. And then there are, depending on where you are in the United States, authorities having jurisdiction will have different requirements for permitting that application. Some require very little, some require quite a bit.
Okay. So, how often should water systems be tested for Legionella? I know you mentioned that first test, if there's no Legionella, you're good for about 6 months. What about the buildings that have Legionella? How often should they be testing to make sure that, it's not continuing or they have it under control?
So just to reemphasize, what I always say is the most important time to test for Legionella is that first time.
Mm-hmm.
And as you said, Nicole, now we know we're in or we're out in terms of Legionella risk. If Legionella is found, what's really important about the testing is what kind of Legionella. And so many people don't realize that the family Legionella is big. There's like over 60 members of the Legionella family. One member of the family, Legionella pneumophila, which caused the original outbreak at the American Legion Convention back in 1976 and continues to be the most problematic. But even Legionella pneumophila has at least 16 members of that species. Well, serogroup 1, Legionella pneumophila, is the one most often associated with infections. And so we want to find out, do we have that in our water? And so if the answer to that is yes, I'm like more concerned, especially in a building that has an at-risk population. But if it's some obscure species like Legionella anissa, which has this really cool characteristic of when you shine a blue light on the culture plate, it fluoresces with blue-white. It's so cool. I guess maybe that's a nerd alert. Only cool for this microbiologist. But if you find some of these other obscure species, the risk is very low. So that first test tells me so much about the risk within the building.
Mm-hmm.
And then if we find Legionella pneumophila serogroup 1, you decide, who's in the building, what's the risk. And in terms of how often you should be testing, then you do some intervention. It could be short-term disinfection. It could be a flushing regimen. Well, probably in a healthcare facility, at least for the first year, you want to do it quarterly, whether it's the water distribution system or the cooling tower. And then you can space that out more depending on what your results are. And then if you're doing supplemental disinfection, at least for that first year, you want to stay on top of it. So you would want to do it quarterly.
Okay. So, what role do building design and construction play in Legionella prevention, and how can those factors be optimized for safety?
Well, many people don't realize that construction is a risk factor for building-associated Legionnaire's disease. And how we know that is outbreaks have occurred associated with construction. And this observation actually goes back, I think, to 1993, when a physician, infectious disease physician, Leonard Mermel, first published on this association with 3 separate outbreaks that occurred at that hospital. And it was associated with construction, pile driving, disruption of pipes, pressure changes, things like that. So we know that construction is associated with it. In ASHRAE Standard 188, in Section 8, is a whole section devoted to instruction about Legionella management around design and construction. What is expected of the designers? What is expected in terms of producing to the building owner the documents around construction? There's even more information in Guideline 12 from ASHRAE about things like what types of fixtures are installed. Are they regular manual fixtures? Are they sensor fixtures? Because, some of these types of fixtures can contribute to risk. So you don't want to put, for example, sensor faucets, which are complicated and have been associated with increased Legionella and another bacteria called Pseudomonas. You wouldn't want to put those in an organ transplant unit, for example. There's less risk with sort of the simple dual blade manual fixtures. And so the role of architects and engineers in construction and design is very critical. Many people that have tradespeople that have worked in hospitals know about ICRA, Infection Control Risk Assessment, which is about controlling dust for fungal infections. Well, now we put a W in front of ICRA. Now we call it WICRA, Water Infection Control Risk Assessment. And we've actually developed a checklist about how to address water-related and construction-related risks.
Okay. So can you provide any examples for our listeners of maybe successful Legionella prevention and mitigation strategies that have been implemented in real-world scenarios?
Well, they're sort of like good news, bad news, right? So the good news part is what have people done proactively, which is what we want people to be doing. We want them to be doing water management. We want them to be assessing risk, intervening to reduce that risk in a proactive manner. If you do that, then the bad outcome of cases of Legionnaire's disease doesn't happen. And so it's kind of hard to measure success, right? So we know that people are being proactive. They are adopting water management per ASHRAE Standard 188. Could there be more? Yes. And so, I keep pushing our mission to end Legionnaire's disease by encouraging people to do water management and test for Legionella and be proactive. The flip side of that is when cases occur, and it gets everybody's attention when cases occur. And so one success story that comes to my mind, and it's actually a Pittsburgh hospital that we have worked with for many, many years. They were proactive. They had put in copper silver ionization many, many years ago and had Legionella under control. Now, this relates to the construction risk. They had major renovation and construction on a hematology oncology floor. And then they had one opening of the floor, cases of Legionnaire's disease. And so they said, hey, Dr. Stout, can you help us address this? And what we found was, again, lots of sensor faucets put in place, increases the ability of Legionella to multiply there. And so what we did, and this is more than 10 years ago, let's try the new method, which was monochloramine applied to the hot water recirculation. And it was extraordinarily successful. And in fact, we just wrote a little review of our 10-year experience with monochloramine in a trade journal called The Analyst. It's from the Association of Water Technologies. And I can tell you that over 10 years after application of monochloramine, no cases of Legionnaire's disease, Legionella very, very well controlled. And so that's a wonderful success story.
Yeah, absolutely. Now we need to multiply that to everywhere else.
That would make me so happy, Nicole.
But like you said, you might be out of a job then.
That'd be okay. That'd be okay.
So, are there any emerging technologies or advancements in Legionella prevention and mitigation that facilities or design professionals should be aware of? Like, is there anything new?
Well, I wrote recently a piece about, can some of the things that are developing in the plumbing industry help us mitigate the risk? And what I see is, we know that water sitting stagnant in fixtures and showers can create a condition where Legionella can grow. And could we, using new technology, mitigate that risk? And so there are plumbing manufacturers that recognize this as an opportunity, basically. And what they've done is, one example is Chicago Faucets. They've created faucets that are programmable, and there's an auto flush fixture, so they're programmable auto flush, so you can, at a certain time period and a certain volume, automatically purge those fixtures of the water that's been stagnant. I think that's a great idea, and I'd love to see more of that. And they also have for showers auto drain. So we all know there's that column of water that sits in our showers because every morning when you turn it on, cold water comes out, right? Even though you've turned it to hot. And that's sort of that water can be in the sweet spot for Legionella to grow. So self-purging showers is a great idea. So there's lots of things that are happening to blend superheated water, instantaneous hot water tanks, for example, take the water very high and then blend it down. So that all of these things, I think, put together from the plumbing industry really help us move towards a safer and Legionella-free water distribution system.
Okay. Now, what role does training and education play in Legionella prevention? And what should these training programs include, do you think?
So I asked myself this question because, I sat on the ASHRAE 188 committee for 10 years, and I'm still on the committee. Yes, I'm a glutton for punishment. And in that document is all this great stuff about, trying to address Legionella risk in building water systems. And, they put in there no training is required because you don't want any obstacles to adoption, right? You want people to be doing this. Well, what I saw over the years when this was out there is like sort of lemmings to the sea. Everybody and their brother and sister said, I can do this water management stuff, but they didn't have the basic knowledge of Legionella as it relates to risk in building water systems. And so I approached IAPMO and ASSE and I said, we need to provide education so that people are doing water management from an educated point of view. So back in 2020, ASSE developed what's standard 12080, and it's a professional qualification standard for Legionella water management. So that requirement, it's a certification, requires 24 hours of training, which IAPMO and in conjunction with us and others are providing. And that's just a wonderful opportunity for me and our team to deliver education over a 3-day live virtual training. We were going to be in person, but then COVID happened.
Yeah.
But again, glass half full,
Yeah.
being virtual really, really helped. And so if people are interested in learning about how to register, for example, on October 9th is the next training, you can go to puzzledbylegionella.com, puzzledbylegionella.com. And there's information there about the training and also the guidebook that we wrote to accompany the training. So education, I think, is really key to being able to do Legionella water management or even water management for these other hazards that Standard 514 is dealing with, like these other waterborne pathogens. And in the training, we have a section on construction. We have a section on other waterborne pathogens. We have a section on outbreak mitigation, and as well as background about Legionella and regulations and requirements there. So education is key, as in all things, including Legionella water management.
Okay, well, that pretty much sums up all the time we have today. Janet, was there anything else in general that you wanted to add about Legionella prevention?
Well, this is what I say. I say Legionella is having a party in the pipes. So just imagine the pipe cut away with little party hats in it. Legionella is in there having a party. Well, your job, all of you listening, is to be a party crasher and crash the Legionella party in your pipes. So go out there, do some testing for Legionella, find out what the status is, do Legionella water management, and help us end Legionnaire's disease.
Well, thank you so much again for taking the time. I'm sure our listeners are going to benefit from hearing you talk about all this. There's a lot of good details in there, and like you said, if they want more information, then go to puzzledbylegionella.com.
Absolutely. Thank you so much, Nicole, for the opportunity to be with you today.